Nearly 180 healthcare workers who were potentially exposed to COVID-19 were tested for the highly contagious virus on Saturday. Deputy Chief Medical Officer Dr. DeLon Brennan said while it would be an unfortunate change, the number of confirmed cases of COVID-19 in the Bahamas will likely increase as a result.
It is entirely possible that we'll see more positives that will come along with it. We're hoping, of course, that our healthcare providers are protected, but unfortunately, we know in these types of situations, the more you test, the more likely it is that you're going to come up with at least some positives.
The mass testing exercises come a few days after Health Minister Dr. Dwayne Sands revealed that more than 200 healthcare workers were in quarantine after possible exposure to COVID-19, including 96 doctors and 62 nurses from Princess Margaret Hospital, and at least 46 staff and 39 patients at Sandhills Rehabilitation Center. A patient on the Robert Smith ward tested positive with COVID-19 after being exposed in the medical surgical ward at PMH.
Sure, we have testing of our healthcare providers from the Public Hospitals Authority, both Sandhills Rehabilitation Center and the Princess Margaret Hospital, who may have come into contact with a COVID-19 patient. Either they have finished their quarantine period or they may be symptomatic at present. So those are the people we want to have tested right now. All of them are quarantined, and they're all healthcare providers.
Testing, which includes nasal swabs, was not a pleasant experience for many of the healthcare professionals.
It is very uncomfortable. It is a nasal swab first that goes into the back of your nose. So most people have never had something like that done before, and it goes fairly far back. So it is not the most comfortable part of it, but we have two tests that are actually going on. So you have the swabbing that's done to look for actual virus, but here we also have blood tests going on to look for antibodies as well. So we want to be able to correlate the antibody tests with the nasal swabs to see if we get positive results on both or negative results on both.
Dr. Brennan said the results will also help officials determine if they can rely on the antibody test and screening capabilities. Reporting for the Guardian News Network, I'm Jared Higgs.